Flu-like illness is defined as fever, cough, sore throat. And of course, that's pretty nonspecific. There are lots of viral infections that result in those sets of symptoms. And what we know now is that the majority of people who have those symptoms right now have the flu because there's just so much spread of the virus over the last several weeks and probably for the next several weeks. And what that points to is that if you develop these symptoms, particularly if they're sort of sudden onset, you felt well yesterday, you're feeling miserable today, it's most likely the flu. The most efficient way to protect yourself against influenza is to get vaccinated. And although there seems to be a bit of a mismatch because of the emergence of subclade K, the vaccine is still effective. And in fact, there's data from the UK that suggests that even in the midst of the circulating subclade K, the vaccine still remains effective in protecting against severe disease. And when I say severe disease, we're talking about hospitalization and we're talking about death. So morbidity, mortality. And that's really the goal of the influenza vaccine. There's no perfect influenza vaccine, unfortunately. The reason we vaccinate is to prevent or decrease the likelihood of severe infection. So the good news is that the antiviral drugs that we have in our toolbox work against the viruses that are circulating now. That's the good news. Although rapid testing is available in many environments, you probably don't even need to get tested because you probably have the flu. In which case, you can call your healthcare provider and say, I've just developed these sets of symptoms, and your healthcare provider should be considering antiviral therapy. And we know that the earlier you get antiviral therapy, the more effective it's going to be. So my recommendation, or the recommendations out there, would be don't wait a day to get tested and then wait another 2 days to see how you're feeling. If you develop these symptoms, go ahead and get the antiviral therapy as soon as possible. And that also will decrease the likelihood of severe disease.